Hi, everyone. My name is Cheryl Cohen. I'm with Arthritis Consumer Experts, and we are hosting the 8th annual #CArthritis event. And I couldn't be happier to be sitting here today talking to the 2022 Distinguished Rheumatologist Awardee of this year's proceedings, and amongst her colleagues, rising to the top and being appropriately feted. Congratulations, Dr. Lori Tucker. We were chatting before we went on air here, but I can think of no one more deserving of this award than you. So let me tell you a little bit more about Dr. Tucker. She is the clinical professor, Division of Rheumatology, Department of Pediatrics in the Faculty of Medicine at University of British Columbia. She has a huge long list of accomplishments and responsibilities. I think what I'd like to highlight is the fact that you do a lot of clinical research in predicting outcomes for children with juvenile idiopathic arthritis and improving care. You look at large groups of pediatric patients, not just in your own center, but across the country and internationally. And play a very strong role in the Canadian Alliance for Pediatric Rheumatology Investigators. And that network, I know, is a really important part of the things that you have done in your career. So welcome to the studio.
Thanks so much, Cheryl. I'm really so honored by having received this award, which is really comes from my colleagues.
Yeah.
I have to say, I sat in my office yesterday during the award ceremony. I had a little cry because, I was feeling a bit overwhelmed, but yeah, so thank you.
You know what? I always feel like tears are we're watering our garden. We're watering our soul in our garden when we cry, and it means, and I guess it's a sign of how much it means to you for that recognition of your peers. Yeah. Well, very sincere congratulations from all of us, and particularly from me. We've known each other for quite a number of years. We thought we'd have just a quick conversation before we let you get back to whatever it is you're doing on the weekend in your office at the hospital. Just wanted to start out, Dr. Tucker, with sharing with our audience how long you've been practicing, not just as a pediatric rheumatologist, but also conducting, partnering, leading pediatric rheumatology research in the country. And I know your work does span the country because you're so well networked as a pediatric rheumatology community.
Well, gulp. I've been doing pediatric rheumatology for 31 years. Amazing. And I've been in Canada for almost exactly 25 years. I came to Canada 25 years ago in February, believe it or not.
Really?
Yeah.
Amazing. And over that time, I know you've seen a ton of advances through your time as a researcher and as a clinician. When you think about, day one in Canada to year 25, what are some of the big sort of signposts on the road that you would point to as big advances?
Yeah, well, recently, actually, I had to move my office. And as part of moving my office, of course, I cleaned my office. And I came across some photos from the very beginning of my career when I was working in Boston. And I used to go to the summer camp for kids with arthritis and rheumatic diseases in New England. And I had some pictures of campers from there. And even I was shocked to look at those photos.
Yeah.
Because there were more children in wheelchairs using crutches. They just look different than our patients look now. So I would say there are so many amazing therapeutic advances in pediatric rheumatology, and they have really made an enormous difference for kids. And it's very hard for people now to understand that, but definitely methotrexate and biologics, and really the approach to treatment, understanding that we have to treat people early in disease. The other thing I think is really an enormous move forward is research collaboration. We didn't really work together that well earlier, but now like Canadian national, international collaboration in pediatric rheumatology is amazing. And that has led to most of the new knowledge that we've gained in the past years. And then for us in pediatric rheumatology, we keep picking up new diseases. So, we now see and care for quite a large number of children with uveitis, inflammatory eye disease, with our ophthalmology colleagues. I mean, I didn't even take care of any of those patients when I was a, trainee.
Yeah.
We are now, the doctors of autoinflammatory diseases and fever disorders together with our ID and immunology colleagues. So we're really starting to branch out and take care of other groups of patients. And that's pretty exciting and interesting.
Yes, it is super interesting. And I just a bit I know about science. I'm guessing, and correct me if I'm wrong, Dr. Tucker, but all of those things you just mentioned that you've now got in your care hug, so to speak, inflammation is the driver. So there's something about this process of inflammation that manifests itself in so many different ways in children and in adults, for that matter.
This is really true. And I know in other centers it's the same, but here at the BC Children's Hospital Research Institute, increasingly there's collaborative work that we get pulled into with basic science immunologists, gastroenterologists who are in the clinic and also in the lab. And I think one of the biggest advances, at least for us at our center in the past number of years, is having a PhD researcher actually on our team. So this has led to, and we've made a decision that every patient should be asked to be part of research. And that decision was made by not just doctors or researchers, by our nurses, by our physiotherapists. So they acknowledge it by the team that the only way we're going to move forward is by doing translational research. And that's a real change in care and in direction. So it's exciting.
Yeah, and it has multiple benefits. One, we know that patients who do get involved in research are actually getting more care because they're in a research protocol. They're being probably seen more frequently. Measures of certain things are being taken more frequently. So in actual fact, there's a rise in care. Plus, as a patient and the family of a pediatric patient, you're learning, you're in real-time knowledge translation, which is so cool, Dr. Tucker. And I guess lastly, because the population of patients, it's not that it's super rare, nor is it super common, the rheumatic diseases in children. So you kind of need everyone to come on board the research concept, to have enough people to study, to do this research with in partnership.
That's entirely true. And actually, by definition, every pediatric rheumatic disease is a rare disease. So even JIA, but if I give the example of childhood vasculitis, these are extraordinarily rare diseases.
Rare, yeah.
And I think people may not be aware that it's actually Canadian leadership that has brought together people in Canada and internationally. And I'll like do a small brag for my group. Dr. David Cabral, Dr. Kim Morishita, Dr. Kelly Brown are the leaders in a pediatric vasculitis study that's been going on for 10 years, has the largest cohort of children with vasculitis and blood samples that are going to the lab to learn about new diseases, new biomarkers. And so, I'm going to put in a brag for
absolutely. I'd say that's two hands on the back of that team.
That's the way forward.
Yeah, I was just going to ask you, how do you think patients and their families today are going to benefit, not just long-term, but short-term in the types of teams you just referred to? I'm thinking personalized medicine is one. If you can look at biomarkers and know, oh, this child might be more susceptible to developing X versus Y, you know how to hone their treatment, I gather, or maybe I'm just making that up in my head. I don't know.
No, that's absolutely true. And so we have two like amazing Canadian projects going on. One is the collaboration through Canada and Denmark, and in the Netherlands,
Yep.
you can do. And that project is really trying to address this question you asked by looking for biomarkers that will tell us, like, when children with arthritis are doing well on a biologic, when can we stop it safely? So that
Yeah.
project's very exciting. But I'm going to tell you my pet project right now,
Okay.
which has been funded by the Arthritis Society and CIHR, is to develop, we have developed algorithms where we can take information that we get from a child and family when they're diagnosed with JIA and make pretty accurate predictions about how they're going to do in the next few years, how medications are going to work for them with respect to side effects, and what they're going to look like when they're young adults. And so one of my colleagues has been working on this to develop a process where we do a shared decision-making model with kids and parents, where we, at the time of diagnosis, we develop one of these little reports, and we show it to the child and the family, and we use that report to talk about what the treatment choices might be. And I think it's really exciting. It's probably a little bit of a paradigm shift for how pediatric rheumatologists currently practice. And we're actually doing a randomized controlled trial of this, which is also kind of scary and hard, but you know, to my mind, what this does, which is awesome, is it brings families and kids into this research endeavor.
Yeah, I mean, it makes research real time. It's just incredible. Well, congratulations on that, Dr. Tucker. Leave it to you guys to be at the forefront of really exciting practice change, but also research change as well at the same time. I'm wondering, you know, I always say, you know me, I've had this conversation with you before. I think there's so many things that are done in pediatric rheumatology that aren't done in adult rheumatology. And I wish we could steal from your playbook that this decision-making aid that you've just described. I'm thinking, well, no one's ever done that with me. And I've been living with my disease for 32 years now. So I don't know, I might just, I'm gonna come dressed to your clinic in my young togs and see if I can slip into your clinic. That is fantastic work. I want to ask you, before we let you go and get back to your busy life as a superstar pediatric rheumatologist, I wonder if you can make a comment or offer observations or drop some bait in the water for future pediatric rheumatologists. Like, if you were to be sitting in front of a room full of medical students, as you often find yourself, you know, what do you talk to them about? How do you get them interested in your specific field? Because there's a lot of competition amongst, you know, specialty physician choices. So how do you do that? How do you and your colleagues work to kind of turn on someone who's looking to make that sort of choice?
Yeah, I mean, I certainly have found pediatric rheumatology to be the most rewarding journey, and I'm just grateful for that every day. And I think if you want to be a pediatric rheumatologist, it's a little bit is like when you decide to be a pediatrician. And I was talking to someone about this the other day. Like, you know, when you walk into the pediatric ward and you feel like you're home, and then you know that's what you want to do. But I think in pediatric rheumatology, you have to like being involved with children and families long term. This is not a short-term commitment, you know, and that's part of the reward, is being involved and helping kids get to their best place over time. You have to like the diagnostic puzzle. And I think that's true for adult and pediatric rheumatology. You really have to like the diagnostic puzzle, and you have to be willing to sit, you know, be patient with that diagnostic puzzle, because that's often a key thing. You have to be a collaborator. I find that it's particularly in pediatric rheumatology, because we all work in an academic institution for the most part, and we work with allied health very closely. And so you really need to be a collaborator with allied health, with researchers, with kids and families. And most of us are academically inclined in pediatric rheumatology. So if you want to be a person who has your own little private practice and that doesn't work so well for most of pediatric rheumatology.
Yeah.
I wouldn't say entirely. There are some people who are doing community practice models, but almost all of us are involved in teaching and research. And I think that's something that you really want to do.
Yeah, I think that benefits patients, frankly, and their families if they are. You are obviously so deserving of this recognition, not just this year, but every year. You've contributed so much to the community, Dr. Tucker, your leadership, your kindness, your sense of fun. You just tick all the boxes for superhuman being, and really appreciate you spending the time with us. And again, from all of us at ACE, we're really happy that you've received this wonderful recognition for all of the great work that you've done clinically and in research, not just here in Canada, but around the world through your network.
Well, thanks so much. And I really, really have so much appreciation for ACE and everything it does. I really appreciate being a friend and partner.
Yeah, we couldn't echo that more loudly. I know that you've been so dedicated to Cassie and Friends, who we often partner with. They're the childhood arthritis charity in Canada and do incredible work. And I know you've given countless hours of volunteer time to them in a leadership way, and you rolled up your sleeves and done everything I think that organization has asked you to do. So we're very, very thankful for that. So we just want to wish you well, and we look forward to the next time that we get to bring you into the studio and have a little chat. So be well, have a great day, and we want to thank everyone for joining us to learn about this wonderful career of Dr. Tucker, and also hopefully learn something new about what's happening in pediatric rheumatology. Thanks for coming.